Jonathan Michael is joining us here. We've been at the Brule Suite to discuss, hear about what is going to happen to the Isle of Man's health service. And they're going to give you £500,000 to £750,000 to come up with some suggestions, answers to this ongoing problem of living in a low-tax jurisdiction and yet delivering an NHS equal and equivalent to what is over there in the United Kingdom. Discuss.
Yes, I think your description of it is a little bit kind of distorted.
Okay.
The total cost of the review the Minister announced is one thing.
That's not your wage, is it?
That's not my wage.
Oh, okay.
No. What I've been asked to do is to conduct a review of the health and social care system here in the island, building on the strategy which was developed in 2015, which talked sensibly about the move towards greater integration of health and social care and greater integration in healthcare delivery. And that's something which many jurisdictions have been trying to deliver for some time. So I've been asked to have a look at what's happening at the moment and whether or not things could be done differently to improve the integration of service delivery. Alongside it also is the question of cost. How much are you spending on your health and social care at the moment? Are you spending enough? Are you spending too much? Are you getting good value? And is there a different way of doing it?
Up to now, we've basically mirrored the UK. I mean, let's face it, it's an easy option, but it's getting to the point with NICE is asking to put X, Y, and Z on the list, and it's becoming obviously a burden. And we've had the odd moment here when we haven't followed completely the UK.
Yep.
But you'd also know about the Jersey sort of situation where they pay to go and see a doctor. I mean, that's again a small jurisdiction on low taxation. I mean, is that the sort of thing you could be looking at? I mean, is everything in for your review? Basically, that's what is the question.
Well, basically, what I've been asked to do is to identify if in fact if more funding is needed to be put in. That's a political decision about whether to put in more funding, and also
no more money, is there? I mean,
well, it depends. That's a political debate. But it's not part of my remit. My remit is to identify the options that you might pursue if it was decided that in fact more funding was needed.
So a better health service. Your option is to produce a better, not a cost saving.
No. But the whole point about value in healthcare is actually to make sure that you are using the pounds you're spending at the moment most effectively. The opportunity to have a debate about what sort of health and social care system do you want, what will it cost, what does it currently cost, and how do you fund it?
Your track record is you've been the top of 3 NHS Foundation Trusts, right?
Yep.
I mean, so you've got to, you've seen it all happen before.
I've been there.
You've been there, seen it, and is there not just a quick fix on this? I mean, do we have to have this massive long period? I think it's next May before you're actually going to give you a full report. Is it going to take that long to look at what we've got?
Well, I think the important thing about these sort of reviews is actually to make sure there is proper engagement. I have not worked in the Isle of Man. I don't live in the Isle of Man, so I need to learn. So one of the first things I want to do is to get out and about, talk to people that are currently delivering services, talk to people that are receiving services, talk to those that live here and their representatives about the sort of thing that they want, as well as their impression about the current services.
I'm sure you've done your background Google checks already on what's been going on and the reviews that have been going on by the Midlands people and that sort of thing, and where we were, and we've had a change of leadership again at the top here. It's seen as a poison chalice as far as political life goes. How influenced will you be by that? Because it is a political body that's giving you this remit.
Yes, I've been commissioned by the Council of Ministers to do this remit. So definitely, yes, the commitment to actually have a good look at what is going on and your opportunities. I think there is a really good opportunity, a very exciting opportunity in the Isle of Man for you to deliver or to have a completely integrated health and social care system, which is actually what people have strived for in many health economies and failed to deliver.
But the model has always been free.
Yep.
In your remit, you could be looking at options other than that to put forward.
Well, looking at options is one thing, making recommendations, but then the decision whether or not to accept those recommendations is a political one. I am aware of the commitment to the principles of the NHS, which have been made here in the Isle of Man. I have worked for the NHS for decades, so I'm a great believer in the NHS. But the principles of the NHS, which is free at the point of delivery, and clinically, based on clinical need, are important. But actually, the reality is we all pay for healthcare. The question is, how do you pay for it? Do you pay for it out of general taxation, or do you pay for it in a different way, or a combination?
When you go to the hospital, will you be sort of shadowed by people? Because I mean, there's always stories, of course, about morale and that sort of thing, and these reviews that have been taking place. How much carte blanche do you have to get inside and to really see what's going on, or will you be sort of
No, I've got a complete carte blanche. But let me get the minister said in the discussion nothing is stopping the work that is currently going on within the DHSC and the hospital to improve operational efficiency today. And they recognise they need to do some things, and that's fine. It's not about the today's efficiency we're talking about.
They brought you in to make obviously some big decisions, which they can or cannot, and therefore
recommendations.
Recommendations, that's the way. How much of a hard hitter are you? Have you got a track record of going in there and coming up with some really big solutions, and have you turned things around? I mean, your CV looks great, but what's the track record like?
In some ways, you need to ask other people.
I'm asking you only because I haven't got your stuff. But do you feel you've done a good job then?
Well, I think I've done. I mean, my work with people in Manchester was similarly challenging in the sense that they have had a long history of disagreement across the hospital sector in the city about how services. I was asked to go and work with them to try and develop the case for fully integrated systems, and then to recommend how to set up a structure and a governance arrangements to deliver those. And there were some quite uncomfortable decisions that had to be taken, but my recommendation was, in fact, there was consolidation, so they have done that.
Do you see this as challenging then, to use that word there?
Yes, I do. I mean, I think it's challenging because it's challenging, but it is also a big opportunity. It's challenging because, in fact, the health and social care system has not changed enormously over the last number of decades. The same applies in England, where I have worked for a long time, and people are trying to do in England what you have the opportunity of doing here, which is to move towards more integrated delivery systems. The problem we've got in England is the legislation is in favour of competition rather than collaboration. Here you've got the different environment. You are not constrained legally by what is done in England. You can make your own decisions.
This won't be your first report for people, and it won't be your last, but do you have hope that these, whatever you recommend, the actions would be taken up, or
yes.
do you leave a bit sceptical on these things?
No, I hope, and there's no point in doing it if it's just being filed.
Indeed.
I did a review for the Secretary of State in England way back in 2007, I think, on the way the NHS looked after people with learning disability. And the answer is the hospitals and GP services were not very good at looking after people who happened to have learning disabilities when they came into hospital or went to see their GP. And I made some fairly robust recommendations which were accepted by the government then. So I remain optimistic, and I don't have any difficulty in telling people what I think needs to happen.
January, you've got an interim report next year,
yep.
which will go public apparently, right?
Yep.
So we'll have a chance to catch up with you and to see how it's all
Absolutely,
going.
yeah, no, this will only work if it's open and transparent.
Right. So people in the health service now who are watching this want to contact you, because I'm not saying they're going to come up with anything particular, but just in case, is there a method to get hold of you to give?
Well, I'm being supported by a secretariat here, and so through that we will be issuing a call for evidence if people want to say something.
Can they be confidential though if they want to be? I mean, that's the thing. Do they have to go on the record, or
no,
it can be a quiet word?
No, it can be a quiet word. It can be a formal submission. Whatever people want to do. I'm here in listening mode.
Is this your full-time position for the next year, or you've got other firefighting exercises going on?
I've got some other commitments, but I've agreed the amount of time that I will spend on this, which I think is entirely doable.